All right, guys, today we're going to talk about knee pain, how to address it, how to identify it, and what to do about it. So there's going to be three things I'm going to talk about. First is identifying. If you have knee pain, let's just say the knee is the pain's coming from here or here, the middle part of that knee, below or above. Usually it's coming from something upstream, okay? If you have pain on the inside of your knee, like through here, it's coming from something upstream through here. If you have pain on the lateral side of your knee, it's usually coming from something up and through here, okay? So one thing is very important to do before you do any kind of mobility, if you do have pain, is to do what I call a test and retest. So do some squats, maybe go for like a run or something like that to be able to identify and replicate the pain. And then from there, you're going to be able to, the starting point is going to be use a foam roller. Foam rollers are fantastic for the lower body. You want to be able to use a foam roller to smash and self-massage. Pretty much your hip, your glute. You can do a little bit in your T-spine, but we're not going to get into that. So when you get a foam roller, I'm going to lay down, I'm going to drape myself over it between my hip and my knee. So I get a little bit of an angle here so you guys can see. I'm going to get into this position, all right? The position of my foot, all right? You can see that my foot's pointed straight down. The position of my foot is going to be relevant to the angle of my quad or the side of my quad that I want to get. So again, if it was the inside of my knee that hurt, I would push my foot out to the side so that I could kind of get the inside of my leg. If it was the outside of my leg that hurt, I would rotate my foot inward, okay? And the way that I want you guys to start off, just as like a foam rolling 101, is what I call the dough rolling technique. That is where you roll the whole length of that musculature, okay? If I'm gonna go side, like right now I'm evenly distributed between my left and right leg. I can just bend my knee, my foot's pointed down, and now more of my weight has shifted into my right leg, my right quad. Okay, so I'm gonna go up and down, and this is an easy thing to think about. I want you guys to do 20 reps. Up, down is 1, up, down is 2, okay? And you're gonna smash that whole length, and then as you get more seasoned with it, you might find like, oof, like right here is a pretty hot spot for me. So I might sit and chill on it and just focus on my breathing, okay? Breathing is going to be absolutely 100% necessary to try to get the muscle to relax. After you do about 20 reps of that, then you can stand up and do retest, okay? So you do movement again, and you see how the knee joint or whatever joint that you have pain, how that feels. You should feel a noticeable difference between test and retest when you do foam rolling. And the idea is that you're using the foam roller to smash and to break up adhesions along that quad. And then when you do a movement like a squat or something that hurt it, that muscle will be free of that scar tissue and whatever the gunk was that's in there, okay? As a protocol, what we want to do is first to be able to identify where the pain's coming from, then to be able to foam roll, okay? And then as a tertiary thing is that you could then get something to balance, grab that quad and to do like a quad stretch, okay? Or another one that I like to do is something called a couch stretch. So this would be, if this is my couch, like normally I'd be, sitting here, right? Instead of getting into there, I would put my knee into the corner of the couch, and then you can get up like this while I'm watching my flat screen TV. But again, this is getting a little fancy. If you get into doing that stretch, that's great, or you can just stand, hold on to something. All right, the rule of thumb when it comes to foam rolling and stretching is right about 1 to 2 minutes, okay, where you're focused on relaxing. This is like if you're in a rush, right? So I could do what I just did, 20 quick reps, that'd be about 2 minutes, okay? And then I could get up and feel a lot better. The person videotaping right now, Brenda, is like, well, I'll do this before and after I run, and then this will be beneficial because then I can feel better before and after the run. It's like, no, if you have knee pain, what ends up happening is you need to address that pain. It's like if you're bleeding from the elbow, all right? It's like you're not just going to address the bleeding, before you do something. It's like, well, you got to address it until it's healed. You got to doctor it, and you have to, wound. What's the word I'm looking for? You got to take care of the wound, so that it can heal properly. In the same sense as once you have identified pain in one of your joints, you want to regularly build that into a routine that you do, especially before you come into the gym here. So sometimes you guys get into class and it's like, hey, you're just like hanging out or whatever. It's like, get on a foam roller and mobilize yourself so you feel better. The main thing with the foam roller is you want to get that quad so it helps the knee, but you can also kind of address that hip. But mainly the knee will get a lot of benefit from smashing that quad up, and then also just doing that quad stretch. And then stretching on the inner thigh. If it's on the inner thigh, this would be like a way, this leg being straight and bending here. Or then if you want to get the IT band, you can go that leg back and then reaching over. And that's kind of like your 3 modes. Okay, this would be right in the front after you foam roll. This would be on the inner thigh, or you could be on the knee like this. You can get on the inner thigh, or IT band with the leg that hurts. That leg goes back, and then you're bowing over, and that kind of stretches out the IT band. That's a good start.